All right, everyone. I think it's time to start. It's 5:30, so we're gonna close the doors so we can finally start with the event. I want to start by saying thank you for everyone who's here, as well you as students and the people here to speak with us. And well, a little bit about us. My name is Dede. I am the managing director of O20. We're quite a new political student party at the UVA. We started quite in the beginning of this year. And we already participated in the last elections, in which we were able to secure 3 seats in the FSR FMG council. And well, what makes us a bit different than any other normal students, we like to make change not only through the council, but also in the day-to-day lives of our fellow students. And one of these examples is Project Major. And that is why you guys are all here. And that is that we find that the university is not giving enough information or giving enough room for you as students to make a well thought of choice in which major or specialization to pick in your second year. And so we decided to invite some students who are at the moment doing these majors or specializations, and at the same time invite some professionals who are working in those particular fields. And we hope that they can help you with making a more careful decision that has a big influence on the rest of all of our lives. So without further ado, I would like to give the floor to Caroline, who is going to be the host of today. And I hope that everyone is going to enjoy the event. And if there's any questions on O20 specifically, don't hesitate to send me personally a message or on Instagram or whatever. But yes, Caroline, I would like to give it to you now.
Thank you so much. Hi, everyone. So my name is Caroline, and I'm in the External Committee, and I'm responsible for the events related to psychology, like this one. I'm myself a third-year psychology student, and I will be moderating today's event. A few things before we begin. Please make sure to stay mute, and it would be really nice if you could, during the Q&A, turn on your cameras. If you have a question, you can write it down and ask the speakers afterwards. Now, about the structure, we will first have the student speaker, Anouk Fieten, talk about the specialization for about 20 to 25 minutes. And then that is followed by the 10-minute by asking in the chat function. Afterwards, we're going to have a 5-minute break, and we will continue with professional speaker Samar Al Zayar. We will have a moderated discussion on clinical psychology for about 30 minutes, and after that, you have 20 minutes to ask your questions. I want to mention that we want to really stick to the schedule, and I will be here to keep an eye on the time. And if you have any important questions afterwards, you can also contact us. Now, I would like to welcome Anouk, who has successfully completed her specialization in clinical psychology at UVA in 2020. Thank you so much for taking your time today, and the floor is yours.
Thank you. Okay, let me share my screen. I think so. Okay. Let's see. So, yeah, this is me. I'm going to start with an introduction of myself. So this is me. You've probably seen my picture around somewhere. Yeah. It's me. I'm a 4th-year psychology student right now. I did my clinical psychology last year, finished it. And this year I was going to go on exchange, but that was canceled due to coronavirus. So now I'm doing just some random courses and I'm taking clinical neuropsychology as a second specialization in the next semester, which is also really fun. And today I'm going to talk a little bit about my experiences with clinical psychology. And yeah, kind of what you can expect of it. So my motivation, it kind of started with why I wanted to do psychology in the first place. So this is me in front of the building when I was like, I think 16 years old. And I came to Amsterdam to an open day, to psychology and some other studies. And I decided that psychology was probably my best choice, and I wanted to learn more about people and what they do and why they do stuff and how they think and how they work, basically everything. So that's what I did. And then I made it through my first year. which is kind of amazing. And so I made it. I passed all my courses. I did really well. And then I was like, well, now what? Like, I'm going to have to pick a specialization. And people start asking me, what do you want to do with it? Like, what will you be when you grow up? And I didn't really know. I always thought I was going to do clinical psychology, but you know, there were a lot of other specializations, so I wasn't really sure. So yeah, I thought, what would I want to do? I want to help people. So that was something that I thought of. Well, what did I like? I like abnormal stuff. So I like people that act differently, who do things differently or think differently than regular people, or like what's the norm. So I kept that in mind as well. And last but not least, I started excluding other specializations. So I started looking at all the other stuff like brain and cognition, neuropsychology, social psychology, and I kept comparing them to each other. And then eventually I was like, yeah, I want to do clinical because I want to know more about like the abnormal psychology and all the disorders. So I felt like that was the best choice for me. Okay, so I'm gonna talk a little bit about the courses and the assessment of clinical psychology. Now, as you probably know, the whole bachelor has changed. So I'm in the kind of the old bachelor, and I'm gonna try to explain like what I went through and what my courses were. I think it's kind of similar to what the new courses are. So you'll probably understand a little bit about it. So this was my specialization. It's in Dutch, sorry. So as you maybe can see, it's a lot of courses on anxiety, addiction, personality disorders. There's a statistics course that's called evidence-based. It's still there. Some courses on psychological communication, and of course your bachelor's thesis, which is really important. And I had one elective that I could choose in my third year. So yeah, that was kind of what my choices were. And then this year it changed, and now there's this. So people who are doing their third year right now, I believe, have these courses. If you know Dutch or understand Dutch, you can kind of see that they're probably mostly the same courses, but then the electives are now current topics. I'd love to get into them, but I didn't take any current topics because they didn't exist. So I can tell you a little bit later about like current topics that I've heard of, but yeah, I think you have to see for yourself which one is about what and what would fit you. But as you can see, evidence-based is still there, so that's statistics. The bachelor's thesis is still there, of course. Clinical interviewing is still there. I think it's a little bit different than what we had, but probably still the same. Mood and anxiety disorders, we had that. Psychotic disorders also. Addiction and compulsive disorders also. Personality disorders, psychotherapy. So as I believe, I've read through the courses and it's mostly the same content as what I had. So I think I can tell you a little bit about it. And then you guys will probably have this, if I'm not mistaken. So I think most of you are in your second year right now. And you are going to be taking specialization courses in the next semester. So clinical interviewing, diagnostic skills, mood and anxiety in psychotic disorders, addiction and compulsive disorders, psychotherapy and therapeutic skills, and personality and personality disorders. So basically all these courses have assessments that are tests, exams. You just have to study. I think all of them have this, except for maybe clinical interviewing, which also has like a practical part because you have to talk and show your skills and record it. In my case, I think they still do that. And then you have to write a paper about it, kind of a reflective paper on what you learned. But most other courses are kind of like the courses you probably had until now that are yeah, with exams. So good luck studying. And then in your third year, you'll have evidence-based, which is statistics. I'm going to get into that a little bit more later. You have your bachelor's thesis. I'm also going to tell you a little bit about that later. And you have current topics. Yes. And those are the current topics that you can pick. So yeah, I didn't take any of these current topics because they didn't exist. I do know that stress and health in disease is kind of similar to medical psychology. I know this because a friend of mine who took medical psychology before wanted to take this current topic, and then she couldn't because she already took medical. And I've also heard that, let's see, a clinical perspective on today's issues is kind of similar to sexology, but I'm not really sure on that. So yeah, can't really say a lot about that, but you'll probably figure it out. I think it's really diverse and also really interesting, all of them. So I think you'll be fine. Let's see. Oh yeah, so I just wanted to put those two next to each other to kind of make a comparison, so you can kind of see that they're a little bit similar. So as for me, I actually took, for electives, I took sexology in my second year, which was really fun. I can recommend it, but well, it doesn't exist anymore, but the clinical perspective on current topics, or what was it called, is apparently a little bit similar. So yeah, it has the same professor as well, Anouk Fieten. So yeah, I can recommend that. And I took medical psychology, which was also really fun and really clinical. So if you like that, then yeah, go for it. Yeah, I think that's about it. So the impact of the specializations. The specialization has impact on two things. It's on the courses, so the kind of courses you take. I showed the courses before, so you kind of know what to expect. If you look at courses from different specializations, you see the difference. And also I based my decision on what specialization I wanted to do kind of on which courses I like best. So I just kind of went through all the courses of all the specializations. And I decided clinical courses were the best for me, or I found the most interesting. So that's also one way to kind of make your decision, I guess. And your specialization also impacts the thesis topics you get, which I'm going to get into after this. So the thesis. Yeah, it's been a few months since I finished it, but it feels like I just finished it yesterday. I'm also kind of still working on it, so maybe that's part of it. So yeah, here's how it's gonna go, or at least what they did in my year. I believe they're doing it again this year, so they probably do it again next year. You get a list of topics. I think in my year it were like 14 topics. This year it's a little bit more. And then you give your top 4. And then some computer program kind of assigns you to one topic automatically, and then it's kind of, yeah, they say it's the most optimal division of students among the topics. So yeah, it's kind of luck, but also I think a lot of topics are really interesting. About the thesis itself, I can only say it's fun and exhausting. I thought it was really fun to really dive into a topic, to really get to know everything about that topic and learn from your tutor, or how do you call it? Your thesis tutor. But also it's really exhausting because you have to like write the whole paper and do the research and do the statistics, which in my case is really not a good idea. But it kind of worked. So yeah. And I wanted to show you a list of the topics, the thesis topics, wow, that were in my year. So as you can see, it's like emotional memories, optimism, depression and health, partner relationships, personality, stress, psychopathology, memories again, MDMA, social anxiety, more on anxiety in relation to spiders, guilt and shame in PTSD, the role of sleep in emotion regulation. Well, there's a lot of it. I can't really get into all the topics specifically what they were, but there's like a little text under it when you get the list, so you kind of know what kind of research it is. Yeah, I took a look at the list of the topics from this year, and some of them were kind of similar, and there were some new ones. So I think it's really similar each year, like the topics and what kind of things you can pick. Yeah, so I think that's it. Oh, yeah, and I wanted to show you my thesis, because it kind of looks like this, and it looks really professional, and when you're done you're like, oh my god, I made this, like I did the thing. Yeah, so I think all in all it's really cool to do, it's really fun, so don't worry about it. Let's see. Okay, unexpected encounters. There were some unexpected encounters, of course, the coronavirus, which happened last year in my specialization year. Yeah, so this might also influence like the assessment in your courses, I guess. Maybe teachers decide to do papers instead of exams. It's really possible. Or like the way of teaching is different. Like, for example, psychological communication, you can't really do it in person anymore. So it's probably going to be a Zoom meeting, which is kind of messy, but also kind of fun. Yeah, so I think that's definitely unexpected. What's unexpected for me as well is that there were a lot of guest lectures. It was really fun, really yeah, interesting to learn from like professionals in the field and like their experiences. So I really liked that. And evidence-based was also an unexpected encounter for me, because I am really bad at statistics and I worried about it a lot. So in my first year, I had like this grade that I was kind of happy with, because I was like, really, I hope I'm gonna pass. And then the second year I got a 6, which I was also really happy with. But then in the third year, I got a 7.5. So for anyone out there who's really worried about statistics or evidence-based in the third year, I think it's easier. It's just a lot of repetition of the previous years. So don't worry about that. Okay, skills learned on the specialization. Yeah, there were a few things that I've really learned that I really appreciated too. So definitely therapeutic communication. Yeah, it was really useful to finally kind of really learn how to communicate, how to do that, how to ask the right questions in the right time. So I really appreciated that. I think a lot of you that really want to do clinical work as well later in life, we really appreciate the courses that go into this. And also the teacher that I had, Floris Linnenbank, was a really great teacher. And he did like some role play with students to really show how he did it and how he worked as a psychologist. So that was really, yeah, really meaningful, I guess. And yeah, another thing you learn is critical thinking about the current system. There's one course in your specialization, I'm not really sure what it's called now, but for me it was DSM-5 and psychotherapy. I think with you it's therapeutic skills and diagnostic skills or something like that. And you really learn a lot about the DSM, but also about critical thinkers on the DSM and what's wrong with it, or like possibly wrong with it. So that was really interesting to kind of not just look at it from a perspective like, oh, it's all good and everything's good, and but also like the other side, like the bad things, and with health insurance and all that stuff. So that was really cool. Scientific writing, I think you learn a lot of that in the first 2 years as well, but then in the third year with your thesis, you really get into it, and it's really fun and you learn a lot from it. And also with your thesis, you learn skills to do research in the real world. I say in the real world because you use real data. Sometimes you do your own research for real, so that's really fun. For example, I did that and I got this graph and I was like, those are real people in there. Like I did this. It was really, really nice to really learn about all that. And not just learn from textbooks and like hypothetical stuff. So that, and then what I wish I learned. So for one, more real life examples. I remember one lecture where there was this girl speaking and she actually had a brain bleed and she recovered from it. And now she came to tell us about what happened and what like the aftermath was and all the side effects she experienced and on her psychologically as well. And that was just so amazing because you really understand and you can ask her herself, like, how was it to experience this and this and you can really ask from like a student perspective or a psychology perspective, like questions about a disorder. And I think I wish that there were more stuff like this during the specialization to really talk to someone with like an anxiety disorder or compulsive disorder or addiction and really learn firsthand what it's like and what people would like in terms of help or like talk or support. And another thing is more practical stuff because we had one course on psychological communication and then the other stuff is all like textbook and studying. But you're kind of, you're studying a lot, but then you're also expected to be a psychologist and actually help people. I think they could do a little more on practical information on how to actually be a psychologist or what a day in a psychologist's life looks like, to really get into that and not just, the theories behind it. And then personal traits and characteristics. I find it really difficult to answer what personal traits or characteristics you should have. I wrote down 3 of them, which are concentration, dedication, and curiosity. Because you have to read a lot, like a lot. And if you don't think it's interesting or you're kind of think it's interesting, but not really, then it's really difficult to keep up with all of it because, maybe then it's not for you. But I think if you have like concentration, dedication, if you're curious about it, if you are interested about it, you'll be fine. So, but I think you're already used to that in the first 2 years because it's just reading a lot overall. But other than that, I think also just wanting to help people or understand people better is probably a good trait that you can have. So the future outlook. So I think after your bachelor's, you probably do a master's. You could just do the bachelor and then do something else or get a job. But I think getting a job as just a bachelor psychology student is kind of difficult. So I do recommend doing a master. There's a lot of them in the Netherlands and also outside of the Netherlands. So you can kind of look into that as well. But other than that, you can become a practicing psychologist, a researcher, a coach. Basically anything. I think overall psychology is a study that really teaches you a lot about people, and that's useful anywhere in life. So even if you want to do something completely different, I think it's really useful to know how people think, why people differ in ways of thinking and have this perspective. I think you can do a lot with this. So there's a lot of options, I guess. You're not really pushed into one direction, I think. And some final advice for you all: don't worry too much. I think I have the tendency to really worry about what specialization I was going to pick or what I want to do with my life. I still don't really know, so don't worry about that. I think in the new bachelor's, there's also the possibility to do another specialization. So if you really like struggling or you find out it's not for you, you can always switch after that and do another one. Or I think don't worry too much. Don't take it too seriously. It's just your bachelor's, I guess. But it's still something to think about. And then, this is the end of like my stuff. Yeah, this is the last slide. So maybe there's some questions.
Yeah, thank you, Anouk, for giving us a proper insight. What is it like to study clinical psychology? Now, I would like to move on to the Q&A. We have about 10 minutes for that. So if you have a question and you would like to ask it directly, you can write your name into the chat function, so I will have a proper overview. And then once your name is being called, you can unmute yourself. It would be nice if you turn on your video as well and ask your question. But you can also just ask it by typing into the chat function, and I will read it out loud. Okay, Anastasia, could you ask your question, please?
Yeah, hi. I was wondering, when you were picking your specialization, what made you decide not to do clinical developmental and clinical? Because that's where I'm still struggling a little bit, because they sound very similar, but I suppose they're not.
Yeah, so I was also struggling on that because I kind of came to the point that I knew I wanted to do something clinical, but then there's like 3 clinical specializations. And I guess I thought that just the clinical one was like the most broad specialization that I could pick. And right now I'm actually doing a minor from, I'm not sure what it's called in English, but it's like on youth and youth detention centers and all that stuff. And I was just like, I'm just going to do clinical and then pick like some extra courses or some extra information on the different subjects to find out if that's more what I like. So yeah, I think to summarize, I think I just took clinical because I thought that was the most broad perspective I could take.
Okay, thank you.
Thank you for your question. Sarah, do you want to go next?
Yes, so you were saying that after, for example, after you finish this clinical specialization, you can also do another specialization, but like, do you know how that works? Because, for example, I'm really like doubting between the clinical one or the clinical neuro one.
Mm-hmm.
And like, I don't really know, like, can I just do like the 2 of them, or do you have to do like then 5 years in total, because the first specialization takes 2 like or 1.5 years, but does the other one take 1.5 years too, or how does it work? Do you know that?
Yeah, so in my old bachelor's, you actually had to take an extra year to do the other specialization, but you have the second semester of your 3rd year, and that's completely free. So what you could do is take the specialization courses of your second specialization in that semester. And because evidence-based is kind of the same for all specializations, you don't have to do evidence-based again. You also don't have to write a second thesis, so you can just skip that. And as for clinical psychology and clinical neuropsychology, I know there's one course, but I'm not sure it still exists in the new bachelor, that you also don't have to take because it's overlapping too much. But yeah, basically you can use like your free semester to do the specialization, and then you have the second specialization. You don't have to do like an extra year or something.
Okay, thank you.
Yes.
So there's a question in the chat. Did you notice a big change in terms of difficulty and study time involved in the specialization compared to previous years of the bachelor's?
Oh, I think, okay, so this is probably different for everyone, but I think I found my 2nd year the hardest in terms of study time and like level of difficulty, I guess. But that's also because in your 3rd year, you're really specializing in something you find interesting. So maybe I did spend more time in my 3rd year, but it didn't feel like it. So I think you spend probably a little less time on it in your 3rd year, but also it depends on the person. Yeah.
Thank you for your answer, and thank you for the question. And Veve has a question. I hope I pronounce it right. We can't hear you that well.
No?
No. Maybe you could move closer to your laptop or to...
Yes. headphones on. Maybe.
Yeah, headphones could be better.
Can you hear me now?
Anouk, can you hear her? I can hear her barely, but
A little bit, yeah, just try.
Okay.
not good.
Okay. I was wondering, does it really make a difference, the specialization you choose in terms of future opportunities? In the sense, I don't know, if I choose to do a work in organizational specialization, then will I still be able to access a master in clinical psychology, for instance? Or, I don't know, I will find a harder time to do so.
Mm-hmm. Yeah, it definitely does matter. I guess it also maybe depends on the master you want to do. I think maybe with a clinical specialization, you can do like clinical neuro masters. But a lot of masters have like requirements for the kind of courses you have and the knowledge you have to have. So overall, I guess with like an organizational specialization, you can't really do a clinical master, or it's definitely more difficult, or maybe you have to do some extra courses. So I do recommend picking a specialization that you want to pursue a career in eventually.
Okay.
Thank you. And I think this is going to be the last question. Does it take a specific special type of person to do clinical psychology? What would you say? So maybe also pursuing the career.
Ooh, yeah, I think so. I find it really difficult to put into words what kind of person it would be. For example, with psychological communication, you could really notice that some people really like the aspect of it, the talking, the helping, the asking questions, and some people didn't really like it, or they like the theory of it but not the practicing itself. But yeah, I think what's most important is that you really want to do it and that you're really interested in it. But I'm not sure if there's like any specific characteristics that I could mention that you should have. I don't know, maybe Caroline does know something.
Maybe we can also ask that our professional later on.
Yeah, definitely.
One last question. Do you have any kind of volunteering tips that can help us to get a better insight into clinical psychology? Because I think I remember you have done quite a few, so maybe it can help the other students as well.
Oh, yeah, I have. I've always liked doing things on the side to get some extra experience, I guess. I do recommend VSPA things. So committees, maybe a board year if you're interested, but that's like a big commitment. So I guess it's not for everyone. But especially like the work-related committees are really interesting to kind of really get into some stuff. There's SPS NIB board, and that I did. It's a part-time board year, and it starts like every school year. It's also really interesting because you get into contact with psychology students and professionals all over the country, so it's really nice. And what else? Yeah, there's like lots of organizations that do offer some type of volunteering, like becoming a buddy, or like a buddy or a partner or whatever. I did some volunteering at 113 suicide prevention, but I think they're only taking Dutch students. So for all the Dutchies out there, that's an option. And I think sometimes the university offers like professor assistant students type of things. Yeah. So you can always ask your professors to if they have any volunteering options for you. Yeah.
Okay, thank you so much, and thank you for talking about the specialization.
You're welcome.
So now we're going to have a 5-minute break, and afterwards we will welcome our professional speaker Samar Al Zayar at 6:10. So see you guys in 5 minutes. Okay, so we had a 5-minute break, and now we're gonna start with Samar. I would like to give you a very warm welcome. Thank you so much for taking your time to come here today, and I will let Samar tell you a bit about herself before you're diving into the interview, could you tell us a brief overview about your personal and educational
Great,
background?
thank you for having me. I'm super excited to be here and to speak to all of you. So a bit about myself. I am a clinical and counseling psychologist. I work with children, teens, and adults here in the Netherlands. I have my own practice, and I also work at a clinic called Psychio International, which is based in The Hague. My background is a BA in psychology and a master's degree in clinical counseling psychology.
Thank you so much.
Yeah.
I'm just gonna stop sharing so everyone can see you, us.
Okay, no worries.
Okay, so just to make sure it is clear for everyone, what is your current occupation?
Currently, I'm a clinical counseling psychologist.
For yourself, right?
For myself and at a clinic. I do both.
So to end up where you are today, where did you study?
I studied at Webster University, so I studied in Leiden, and I also studied in Austria, in Vienna, for my bachelor's.
Okay, thank you.
Yeah.
So time flies by very, very quickly, and sooner than later, we will be pursuing our master's. How was your transition from bachelor's to master's, and what helped you during that time?
Well, it was actually a rather exciting transition, I would say. I think my bachelor's degree was definitely more broad, so I studied all sorts of anything related to psychology and even outside of that. My master's was definitely a lot more precise, practical, so I felt rather excited that I was one step closer to becoming a psychologist. It was a lot more real and relevant. It was a pretty smooth transition, I would say. I think the only advice I would give there is, or the only difficulty, I think, is paying attention to statistics and research, because that would have helped me with my thesis a little bit more. I don't know if any of you guys can relate just yet, but apparently that's very important.
Yeah, I can totally relate to that already.
Yeah.
So when did you know that you really want to do clinical and counseling psychology? Was there a specific event, or did you have some kind of switch where it was like, yeah, okay, I want to do this and nothing else?
Yeah, it's, I went through definitely different periods. I think I was pretty lucky that at a very young age, I knew I wanted to be a psychologist. I took a psychology course in high school, and I really enjoyed it. And then I also lived in a country where psychology wasn't really accepted. And I noticed that people around me really needed it, but didn't have a place to go. That was definitely an inspiration. And then I explored different areas of psychology during my BA. So I was like, should I do organizational psychology? Should I do social psychology? I really had to go through different internships as well. And then eventually I thought, clinical and counseling is what I want to do, based off of some internships and speaking to professors and professionals.
So a lot of like you getting your own information, internships to really figure out, okay, clinical is
exactly. Yeah, it's hard to just know off the bat. You really do need to go through it. Yeah.
So what is something that you wish you would have learned earlier? Like, are there any activities or skills that you would advise us to focus on, which will already prepare us for masters, but also for working life?
I think, again, really internships as much as possible in different fields. Shadowing as much as possible. So if you reach out to psychologists and you ask if, hey, can I sit in a session, whether it's at a school, university, hospital, I think that's also really important. And for the rest, you learn as you go. I've been a psychologist for 5+ years now, and I'm still learning every day. So you can't go in fully prepared. You just kind of learn as you go. And you learn with your patients as well, believe it or not. So, yeah.
So you were talking about internships, and we know that the job market or internship market is very, very competitive. It's very hard, especially for clinical psychology, to get the internship that you want. Is there any volunteering experience or something that we can already work on now that is going to be on our CV that can kind of like help us stand out from the other students that might have just been doing their bachelor's and that's it?
You know, I would say I got really good advice from an old professor and a mentor once, who said to me, you know, you're young, you can handle basically the most intense cases if you can. So go for something super difficult. So she always recommended I go for forensic settings, because those are the most challenging. You're dealing with really challenging people, and psychiatric wards. So if you can get your hands on either two, and usually there are quick turnovers because they're highly stressed jobs, so you might be able to actually get in. That's always quite helpful in that. I think that helps you stand out.
So
And
you ended up going for forensics, if I understood it right?
No, I ended up going with a psychiatric ward instead. I didn't get into forensics, but I would say either or are both pretty intense, and then that might help. And also don't be afraid to leave the country and explore other countries for that, of course. That's always helpful.
How was your experience doing your internship in the psychiatric ward? Like for me, that's like, you know, you watch all these movies and you kind of have an imagination, but really being there is something completely different.
It definitely builds thick skin. I think I was definitely also a little bit nervous my first few weeks there. But then you also start to put the theories that you learn in school, and you start to go, oh, okay, I study the DSM and I studied that these are the symptoms of a psychopath. Okay, and then you start sort of matching, and that sort of makes it all more real.
Okay, wow, yeah, I can totally understand that. And that, yeah, I think hearing about this is very like something different, because I personally don't know many like clinical psychologists that have like have such an, you know, insane experience, because that is quite something. And just hearing it from you, it gives me a very good insight into clinical psychology.
Thanks.
So moving forward, is there so when you were transitioning from your studies into work life, we know, or at least we're told, that it's very, very hard, because studying is not real life, according to a lot of professionals. What is something that you found actually very, very easy and something quite difficult to deal with when transitioning?
So what I found the most difficult to deal with when transitioning was, I'm sure you guys have heard of imposter syndrome. So confidence. I think that's something that I wasn't expecting. Going in, and you're seeing all sorts of patients that are, you know, sometimes 60 years old or older, and you're wondering, okay, are they going to take me seriously? I'm young. Do I know? I don't have, you know, if it's about kids, you're saying, okay, I don't have kids. Or if it's about retiring, you're saying, well, I haven't retired. So really, that was important, I think, to talk about with supervisors. Because at the end of the day, I think you all have to remember that you did study human behavior. So although you might not have the life experience, you do have this, and that matters. Credentials do matter in that field. So I would say that that was quite difficult to go through. And something easy was actually really just relating to the patients and learning very quickly, a lot faster than probably even at school, because you're just sort of thrown into the deep end.
So you would really like advise us to kind of like keep in mind that we did study this for over 3, 4, 5 years, and we know it, and we should really apply that knowledge.
Exactly. And that you don't just be okay with the fact that you don't know everything just yet.
Yeah.
And you don't have to copy certain styles. You eventually also find your own authentic self in the process.
And I think we will also learn with experience what works best.
Yeah.
Okay. So when we go into clinical psychology, there's a lot of different jobs we can be doing. You decided to have also your own practice called Samar Therapy. What is something that you value a lot, and what is very challenging when you have your own practice?
Well, something I value a lot is definitely, you know, helping patients, seeing even the small steps, that the bravery, you know, just the fact that they come into sessions when it's already really scary to open up to a stranger. I definitely value that. What I find to be a bit difficult with private practice is sometimes it can be quite lonely because you're working on your own. It's just you and the patients. And so it's really important to reach out to colleagues or people in your field to just sort of bounce ideas around, to get a different perspective. keep in touch with a supervisor. So I think that's quite challenging. Yeah. And on a practical note, I would say also being in the Netherlands and opening up your own practice is not as difficult as I thought.
Okay,
Yeah.
that's really good to know.
So yeah, if anyone has any questions in terms of practicalities, it's pretty straightforward. Yeah.
I would imagine that if you work with, like, if a patient comes in and they talk about, well, depression or anxiety, how does that affect you? Because I've talked to a psychologist where they were like saying, yeah, you need to learn how to distance yourself. And then others tell me you need to really like feel with them, be empathetic, and like, what do you
That's
apply?
a really good question. I think, again, I think that's something you learn with time. I think at the start of my career, I might have taken some things home, right? And really let it get to me. And that's the between empathy and sympathy as well, right? You do genuinely care, and it does, you are giving out your own energy. But again, I think it's with time that you eventually learn to distance yourself a little bit. I don't know if that answers your question. I think there's just like a fine line between.
Yeah, so you wouldn't be like, when you go in, you're not gonna know how to like handle it, I guess, and take home a lot of emotions and feelings, but with time you realize it's affecting you as well a lot, and it's better to just leave it in that room and then go home and
if you
kind of
can.
distance yourself.
Yeah, if you can, definitely. And I think self-care, so being very aware, let's start with self-awareness first, and being very mindful. It's okay that it affects you for a short period of time, and then you say, okay, let me give it 5 minutes, let it affect me, and then let me put it away, and then let me do something that makes me feel good. And I think that's a really good advice is always self-care as a psychologist. Your weekends and after work hours are super important because it does take a lot of energy. So you just want to re-energize and then give it back again.
Yeah, and taking time for yourself is definitely in any setting very, very important. So what is something that keeps you motivated to get out of bed every day?
Again, really, I love what I do. So that's enough to motivate me. Seeing patients, helping people.
So I'm guessing it's also seeing like how patients come, and then when they leave, it's a completely like different energy, different like results.
Absolutely. Yeah. And I think that's very, that's definitely very encouraging. It makes you just want to keep going.
Yeah.
As cliche as that sounds, it's true. Yeah.
Sorry.
Yeah.
Do you have any preference working with children, working with adolescents, with adults? Like, is there something that you very, very enjoy? For example, anxiety disorders or depression, or do you just enjoy all of it?
I enjoy all ages, I have to say. I think I'm pretty lucky that I have that kind of diversity. But in terms of what do I enjoy, I definitely am more interested in trauma therapy. And personality disorders. I find those two very fascinating to work with. Yeah. And also my specialty is third culture kids. So expats, people who have, gone through, okay, who am I? Where am I from? As an expat myself and a third culture kid, I also really like working with third culture kids. I can relate.
So what would be, because I myself also am a third culture kid, what is the most like common problem they come to you with?
Third culture kids, I would say most likely it's where do I belong? Where is home? Who am I? Right? I never really fit into a certain culture. I go home and I'm not fully from there. I'm in Holland. I'm not really from here. So we kind of go through that and explore that together. And a lot of them just end up accepting the fact that they belong in this third culture world. Yeah.
Okay. Because I was asking about this since I know you also wrote your thesis on this.
I did.
And you seem to be very enthusiastic about that.
I am, yeah.
So could you tell us how your typical day would look like from getting up to going to bed?
Okay, sure. And I can, well, if I'm going to the office in The Hague, then I'm commuting and I might listen to a podcast. I have a few really nice psychology-related podcasts that always inspires me. And then I'll get into the office. I will grab my coffee, say hello to my colleagues, check my email, and then take a look at my agenda and see who I have for the day. And then read up on the, let's say first few files and what we discussed in the last session and what we're going to work on. And if I need to prepare anything for the session, I'll do that. If there's any paperwork or exercises I need to prepare for the session, I'll do that. And then it's sort of, let's say it's about almost 6 patients a day sometimes. So then you kind of go grab them, come in 45 minutes, you have a 15-minute break in between to sort of write down the notes of the session, and then read up on the next file and do the same thing. So sometimes it's pretty busy and then you just have to really time manage. And then, like I said, self-care. So during my lunch break, I completely shut off. I don't talk about work. I don't think about work. I'm completely 45 minutes of just like taking a walk or chatting with colleagues. Okay. Yeah.
So does it differ? I guess it doesn't really differ if you go to The Hague or you stay in Amsterdam to do your session.
Similar. It's pretty
And
similar.
how many patients would you have, like a max per day?
A max would be 6 per day. Yeah. Preference would probably be 4 a day. Yeah.
I can understand.
Yeah.
So 1 second. So you are a multilingual with an international background. How has that shaped your work experience and just life here in the Netherlands?
Well, definitely, like I said, I'm a third culture kid, so I can relate to people of different backgrounds. But I have to say, while that's an advantage, credentials are also important. So even if you're not an expat or you're not an international third culture kid, I think you can still relate to people.
So you were talking also about credentials. So I would think that it's your university grade, also what university you would go to, like in clinical psychology. Is there a grade is that important, or is the university very important, or is it the internship, or just having a lot of contacts? What do you think is like the most like important factor?
I think it's not just what university you go to. I think it's what you do afterwards. So it is the internships, the places you intern at, and also the courses that you take afterwards. So for instance, if you want to take a CBT course or an EMDR course, or certain things that are, what's the word, accredited, that's the word I'm looking for, then I think that people definitely look at that on your CV. So you guys are constantly going to be learning and constantly going to be adding things to your CV for a really long time after you graduate.
So you would advise also like a lot of, I guess, workshops, so also like credentials, so then we have something to show, not just our education at the university.
Absolutely. And I think Anouk, she mentioned 113, the suicidal hotline. That's also great to have there are loads of courses online on prevention, suicide prevention and things like that. So you can even start from now. I remember doing that already in my BA.
So I think that there's a lot that only Dutch students can access. And we are, especially now, a bachelor also for internationals. Is there something you would advise us to do? So for example, we have a study association called VSPA. They do organize events. Do you think joining them, so we have like some kind of experience, would be nice? Or should we go more to like practical internships?
Both are great. I think they're both quite helpful because the first part shows leadership and taking initiative, which is also wonderful. And then if you can do any sort of volunteer work where you're working with people, and if you can't get your hands on something psychology related, I remember doing lots of work with refugees or in NGOs. So you're still working with people, or schools even, right? If you're teaching, so that's also helpful.
I think that's something we can also work with, because getting into like more psychology related internships is very hard if you don't speak Dutch or if you aren't Dutch. So I think I've seen also there's volunteering for old people, even if you don't speak Dutch, just, being with them is already enough.
Exactly. Yeah.
So I would like to fast forward into the future, where do you see yourself, your career going in like 5 to 10 years?
I think I'd like my private practice to grow and maybe even include more online. Well, I already started that because of COVID, but also online therapy where you can reach more people around the world, people who maybe don't have access to it. I would definitely like to include human rights. So I studied that on the side, and I would definitely like to be more involved there, but with more trauma therapy, like I mentioned earlier. And also just being a voice to break stereotypes, psychology stereotypes around the world. Yeah.
We have a lot of those.
Yeah, a lot of goals, maybe too many.
Okay, I'm a bit lost. Oh yeah, okay. So we're slowly coming to the end of all the questions I have. And my last question for you is, what is your final advice for us who are currently in their second, third year doing their bachelor's?
My advice would be during your free time, if you can, again, volunteer, do internships, or just shadow, even if it's once a week. I know you guys probably have a lot of work to do, but if you could do that, listen to podcasts or read up on journals, just keep up to date with what's happening in the world of psychology, because it's constantly changing and updating, and also maybe thinking about what the future would need in 5-10 years. So already we're talking about online therapy. We're talking about apps, right? So maybe think about those things that might be helpful, and then you can add something new to the field, because it's quite a classical field as well. You know, it's very slow to change, and there's so much resistance to online therapy, and there's so much resistance to apps. So I think the future generation is probably going to push for that a little bit more.
So what is your opinion on online therapy? Is it different to having someone sitting in front of you?
It is different. Definitely it's different, right? Because you are missing on body language a little bit. You're missing on social cues, but it's different, but it doesn't mean that it's any less better. Yeah, we can make it work, and we're just gonna, well, we have to now, right? We're trying to get really creative with it. So yeah.
Okay, so thank you for answering all my questions. Now,
those were great questions. Thank you.
Now we would like to open the floor for any questions you guys might have. If you have a question, again, you can put your name into the box or just write out the question.
I see lots of questions coming in here in the chat.
Okay. Okay, so I would guess the first question is from Doa. Which podcast do you recommend? What is your favorite one?
Good question. I like Psychology in Seattle. So there are two therapists who are also professors and supervisors. And they talk about, it's super great to put in the background. I also really like, if you guys have heard of a couples therapist, her name is Esther Perel. So she has two podcasts. So one is called How's Work, where she has live sessions between people at work. And then she has another one for couples called, actually just forgot the name, but you can just put Esther Perel on the search and you'll find it. Yeah, I'd say those three.
Thank you for that question, and thank you for the answer. Anastasia.
Hello, I have a lot of questions. Thank you.
Great.
The main one is probably being an expat myself and a non-EU student. I always wonder how difficult it is actually, well, for example, opening a practice here or even becoming a licensed therapist, because when I started reading about all the registries and big and, to become the psychologist. Yeah, so I was wondering what you could
so there indeed I definitely think I wish that there was something a lot more straightforward for people like you, right? Because you really have to kind of dig until you find the answers. So in terms of opening your own practice, actually, if you don't so much care about getting the health insurance coverage, which is you have to be a Becher GZ registered to do that. Then you could literally just register yourself as a freelancer at the Chamber of Commerce, and then find an office space and be a therapist.
That's great. That sounds
Yeah,
great.
otherwise you could take a look at the NIP. That's also very expat friendly if you're already aware of it, the NIP. Yeah. They're always really great also with answering all your questions.
Okay.
And I know to be a NIP member, NIP registered, you just need a certain amount of hours. So I think about 1,500 direct client hours, and then you can be registered with a NIP. Yeah.
Okay. Thank you. And just one more question about the internships. I was wondering if you actually did them during your study, or were they all after the master's?
They were during my studies. They were during my studies. So for example, in the summer.
How did you manage getting them?
In the summertime, during my break, those were the main times that I would, so even if it's like 2 weeks, just to get an idea of what kind of field I wanted. So yeah.
Okay, thank you.
You're welcome. I hope that helped.
Thank you for your questions. Next one is Bebe again.
Yeah. Hi. Actually, Anastasia kind of asked you the question I wanted to, so I'm gonna go with my second question. And how do you get to work with a broad range of different ages among patients? Because I know, for instance, here where I'm from, you kind of specialize in an age range, and then you mainly work with this age. And that's why I'm so undecided between the specialization, because I don't really know if I rather work with children or adults. So I was wondering if it's just different there or.
So I studied, I studied counseling and psychology. So I didn't study child psychology actually, but I had a few jobs afterwards that worked with children. So for instance, at a school and also at an autism center where I was trained in, for instance, ABA therapy. And so that helped me get something called the SKJ here in the Netherlands that allows you to work with children and make sure that you're safe and you have all the right trainings for it. So in some countries it's just with experience and you can work with kids, and some countries I guess not. So maybe my advice is try both during your internships, maybe work with children once and then work with adults and see what you prefer. Yeah.
Thank you.
Yeah, you're welcome. Thanks.
Thank you. So next one is Teresa.
Hi. Well, first I wanted to say thank you for all of the information so far. And as it has been said before, I would also have like a million questions.
Okay, no problem.
But I'm just gonna make two that I think are the most important to me. So I've always knew I wanted to be a clinical, well, not always, but I've had it pretty clear on me. But now there are like two things that are worrying me a bit. So first, I wanted to ask if you have the feeling that the therapy you give changes as you grow as a human, because of course a lot of what you put in your output in a therapy session is what you have learned in courses and in university, but I guess there's also a lot of what someone is as a person. So then I just wonder if the things I would do 1 year could be really different from the help I would provide the next year, and that makes me feel a bit insecure. So that's the first.
What about
question.
It makes you feel insecure?
I don't know, because maybe like the way that I would try to help the patient face a certain subject, I may find myself in my own life sometime later that it was actually not the right thing. And of course you also don't want to push your values and your philosophy and your way of seeing life on others. So like as when you grow, then your therapy also grows, but that's actually affecting real people and other lives. So that is very intimidating to me.
Yeah, I understand that. I understand that it can be. And I think as you start, you probably want to take on patients that you can handle, of course, nothing too complicated where, that doesn't come up, but also don't be afraid to learn as you go. It's okay. And even if you make a mistake, it's okay. And it's okay to say that to your patient as well. I think being honest is definitely helps with a therapeutic relationship. So to be able to say, hey, you know what, I think I tried something and it didn't really work. I'm going to try something else, right? It's okay to do that. And in terms of transference, so if I'm going through something, is that going to be then, is that showing or is that triggering? With time, you also tend to realize that you become less judgmental. So maybe you have your own values or judgment about something. You'll notice that in the session that most likely isn't going to come up. And if it does, that's why you have supervision and intervision. So then you discuss that with your supervisor and you say, maybe it's triggering something, or maybe, I'm feeling really guilty about something, and you work through it. And also, I think this is why some countries recommend starting your own therapy, right? So going through therapy yourself to work through some of those issues, just so that doesn't get in the way with you and your patients.
Yeah, thank you.
Yeah.
I think maybe it's also a bit related to the second question.
Okay.
Because it would be like, because I have seen myself sometimes that words of the therapist on myself or also like on loved ones have had not the desired effect, to say it somehow, like in the trying of helping. Of course, we are really complex, and then that's also something that really scares me, would be the possibility of hurting a patient when I'm actually trying to
help them. Yeah, I understand that fear. And again, I think, ethics is super important here, right? So make sure that everything you're doing is ethical. So you're not purposely harming them, and supervision, right? So maybe someone you can always go back to, and that can help you through the first few years of your career, where you can avoid that. But I think as long as you're not purposely harming, I understand that people are easily influenced, right? So you do have to be careful what you say, but with understanding the ethics of it and also having a supervisor, you're going to be okay, and you'll learn as you go.
Thank you. And I just want to ask the last thing. I was wondering, do you think being a clinical psychologist is a profession that allows you to have time for other things, or is it really demanding and takes more time than the actual hours with the patient?
Other things like what?
I don't know, like, for example, in my case, I have a lot of side interests that I would like to go for apart from clinical psychology. And then I think in long term, I wonder if I would have time to, do both things, or if there are jobs that you don't only work from 9 to 5, but after 5, you actually need to be working on that too.
No, I think you can just stop after 5 and, leave that for the next day. And if you have your own practice, of course, then you can work as you please and still have time for interests. And in the Netherlands, it's actually recommended for a therapist not to work more than 4 days a week. So you can have that one extra day to, get back on track and self-care and do all of those things, because it is important. That's how important it is that even the healthcare system acknowledges that. So,
okay, thank you.
Yep, you're welcome. Thanks for the question.
Thank you for your questions. I really, really like them. Like, it's stuff that hasn't been really going on in my mind, but if you really put it out there, I think it's very helpful. Also, what you told her. Thank you so much.
And I see some really great questions on here.
Yeah, there is the next one from Inez. What was opening your own practice like?
So that's one thing that actually they don't teach you in school is the business side of things. So that actually took some time, and really talking to friends who are not in psychology about marketing, about branding, about finances, and then the logistics of it itself. I don't know if that's your question in terms of in the Netherlands. Then, like I mentioned, going to the KVK and opening up as a freelancer, finding an office space. So for instance, they have these great offices around the Netherlands called Coach House. And basically they're buildings with a bunch of therapy rooms, different sizes, and they have everything you need in there. And you just pay a membership fee and then pay an hourly fee. Setting up a website is also important. Word of mouth. So I think to get a full practice running, it takes about 2 years. which is
That's
word of
longer
mouth,
than I would expect.
branding, and everything in between. And yeah, to really get that running.
So for that, you obviously also reach out to other people, not just psychologists. So marketing, the website, designing.
Yep, you really started I had to think about all of that, which I never thought of before as a psychology student.
Yeah, because if you aren't taught or told anything about that, you don't really think about it.
Exactly. Yeah.
Okay, so let's move on to the next question.
I hope that answered your question.
I hope so too.
Yeah.
What made you choose the Netherlands to pursue your career as a psychologist?
Yeah. So when I was in Austria, I wanted to come here as an exchange to do a statistics course. And I thought, I'm open to living in a new country. And so it was sort of by coincidence, actually, that I ended up coming here.
Did you have a problem with the language, or did you take a language course before?
Well, I took a language course, but it was also, everyone here is so great with English. And I think if I had the language, I'd probably have more opportunities, though, in the workplace here in the Netherlands as a psychologist. So if you speak Dutch, then you're lucky. You'll have more options for sure.
So we as internationals still obviously have options to also kind of have a successful career here if we don't really speak Dutch or not that well.
Yeah, but it's definitely a bit more challenging than if you weren't.
Yeah. I guess it depends also on your dedication to
Indeed.
if you really want to do it here.
Exactly. But definitely not impossible, yeah.
Okay, so then there's the next question. Was it difficult to find your first job after graduating? How did you experience this? And what are the things we can do now already to prepare for this in advance?
Okay, so was it difficult to find my first job? I think, so my first job wasn't actually in the Netherlands. I went back to the Middle East, and that's where I got my first job before coming back here again. So it was not too difficult because in that part of the world, there aren't enough psychologists.
Yeah.
And I think it also helped that I had plenty of internships. So I worked for many years for free, just so I can, get my CV up. And there was a lot of competition coming back to the Netherlands, lots of students. So I think that's why I said, don't be afraid to go out and then come back if you can. But finding a job in the Netherlands was a bit more difficult, yes.
And how we can prepare for this is obvious experience, internships.
Yep.
I would say like that, right?
Yes, internships, experience, extra courses if you can, even if they're free courses online, fill them up.
Okay.
Yeah.
So then there's a question by Stephanie. Why exactly did you decide to open your own practice?
Well, I like the freedom of being able to see different patients and not restricted to just, people that only have people in the healthcare system. I like that I can also work online, which is to reach more people in different countries. And I also know that it takes a really long time to build a practice, which means if I can work somewhere else and also build my practice at the same time, then get the best of both worlds. That's why I decided to open it. Yeah.
And then are you thinking about then at some point just working for yourself, or is that just still?
I think in the long run, yes, but I'm definitely gaining more by working around people and people who have been in the field longer than I have before I move on to private practice.
There's also a lot of experience and stories from others that you can learn from.
Absolutely, yeah.
So there's another question from Ines, which I'm not sure what you mean, but it is, how long do you have a supervisor for?
Yeah, for as long as you can, honestly. I know people who've been therapists for 30 years and still have supervisors. Eventually you become a supervisor if you want to, but I would say for as long as you can, so 20 plus years. And you can have different supervisors if you want. You don't have to stick to just one, because then they tend to give you only their point of view, and you do want different point of views. So I would say if you can switch it up every few years or keep one for a while. Yeah.
Okay. Then Felix is asking, how were you able to get a diverse group of clients or clients in general? So I think he means how you attract them while opening your own practice.
Well, when I do my marketing, I reach out to different places. So for instance, if I'm going to reach out to more professional settings, then I'm getting professionals. If I'm reaching out to schools, then maybe I'm getting expats and parents and teens. So that's how I get a diverse group. Yeah. And pro bono, then I would go to, somewhere, another area. Yeah.
Yeah, I think that answers the question. And then another question. Would you suggest us contacting therapists ourselves and asking them if we could shadow their work?
I would say try. Yeah, absolutely. I think if you can, some people wouldn't mind. I would say schools don't mind if you have like an extra day to help out. With shadow, we want you to be consistent. So it's either going to be one time or it's going to be consistent with the patient because they probably want to get comfortable around you. Yeah. So yeah, I would say try. LinkedIn is a great place to start. Yeah.
Definitely.
Yeah.
Are there any more questions? You can write them in.
Those are all really great questions, guys. Thanks.
Okay, I think that's it. Or
yeah, absolutely.
So then I would like to thank everyone for attending tonight, and we hope that this gave you an opportunity to better understand clinical psychology as a specialization, but also what is it like to be a clinical psychologist, especially for the second-year students who have to choose their specialization in a couple of months. And I want to thank the O20 team who has worked really, really hard day and night to coordinate such a large project and to make these events possible. And at last, I would like to thank you, the two speakers, Anouk Fieten and Samar Al Zayar, for coming today, taking the time and answering all our questions. We wish you all the best for your future within and outside of clinical psychology. For the students, if you want to find this meeting, this event again, or you want to share it with others, we have recorded it and we will post it later on YouTube. Apart from that, thank you everyone. And I think that Samar would like to say quickly something about.
Well, thank you so much. This is so great, and I love being part of this and sharing my experience and being helpful. If I was, you guys can always ask me questions, and I'm also offering a discount for guidance or coaching, so you can always email me. Should I just write my email here?
I think we can also send it out later because
yes.
you have already left.
Yes. Okay, perfect. Then I'd love to be part of that, and I know what it's like to feel a bit lost at first, so I'd love to be a part of that. And thank you again. This was really great.
Thank you for coming.
Great
yeah, I'd just like to add one more thing. Please don't hesitate to email, message, or DM us. The contact details listed on your invitations if you have any questions or concerns. And keep up with our upcoming events and our updates, and follow our Instagram at o20.nl. And everyone just have a great night.
Have a great night, everyone. Thank you.
Thank you so much.